First, we'll start with President Sirleaf. Liberia did everything right and then got gobsmacked by this Ebola epidemic. So I think we should start by just give them a few minutes on what you're doing now. How do you begin again? Where are you, and what can this group do to be most helpful?
Well, let me say how pleased I am to be a part of this. And President Clinton, let me thank you. You came out right in the midst of our most difficult period. And, you know, that was quite risky, but you did. And I want to thank you on behalf of Liberians. Well, this unknown enemy that we did not know how to fight, how to respond to it, just really took a lot out of the steam, the enthusiasm, the progress we were making to try to reconstruct our economy, renew our nation after 2 decades of conflict. When Ebola hit, we were already having growth problems because of global commodity prices that had declined for our 2 major exports. Ebola then really drove the growth right down from the 7.9% that we're experiencing right down to zero. The educational system, because schools closed for an entire school year. Our farming system, our food security, because farmers, everybody afraid, were running all over the place. Well, today we're trying to rebuild. And I can say that the success we have that has brought us today, we can say to everybody, thanks to all of you, we're Ebola free, it's been so declared. And so our investors who had left are returning, our contractors working on our infrastructure program returning, farmers are back, the current season, and we're planting again, the kids are back in school, and so. But recovery is going to be difficult because we lost a year of progress, and it's going to take a while to rebuild for a nation that was already in the process of trying to rebuild and trying to improve the massive destruction that the country faced. Where we are today, as I say, the process of reconstruction is on. Our greatest needs are going to be, first of all, to fix our healthcare system, to make sure that the experience of Ebola are addressed, the challenges resulting from that are met. And that's what we're trying to do, use this to reform education. We've identified our 4 major pillars of our agenda for transformation: education, health, infrastructure, and agriculture. Nothing new, it was part of our agenda, but it's just trying to re-energize ourselves, to accelerate our effort to be able to achieve those. Our success, like I say, due to perhaps 3 things. First of all, community. Our communities took charge, took ownership, took responsibility. Secondly, partnership. Partnership from so many of you in this room, in the organizations and institutions which you had. And leadership. Leadership at all levels in the society. So. We're on the way back. Thank you.
Ken, last year, our first CGI commitment involved Merck. We had Direct Relief International make a commitment to fly 100 tons of medical supplies to Liberia and Sierra Leone. In the end, this commitment grew to 500 tons. I believe it's the largest private aid delivery ever organized. It had nothing to do with government functions. I was overwhelmed by it. And I'm exceedingly grateful to everyone who was involved. But what happens now? Does this Ebola epidemic in the aftermath, since we know we can have another one somewhere else in the future, since we know there may be other relatively untreatable problems develop in our interdependent world, is it an opportunity or just a problem? And what is the role of corporations? You just wait for something bad to happen and come up with the drugs that you otherwise would have to sell? Tell me how do you think about this going forward?
Well, let me start by thanking you, President Clinton, for having us here, but also for convening private and public entities in a way that builds trust, because I think that's going to be important as we move forward to try to tackle some of these problems in health and education around the world. I think it's definitely an opportunity. I think we need to be prepared. I think we need to cooperate and collaborate. This Ebola thing came from nowhere, but yet it's been a problem going back to ancient times for mankind. We were very fortunate that we were asked to use our vaccine expertise to come in and pick up on a program that has now so far shown great promise and encouragement with the vaccine that we have been testing. It's not a vaccine that we can fully say is effective in every place, but we have at least had some very positive data. So I think the key to your question is that I think as a world, I think those of us who are fortunate to live in the developed world need to come together, whether you are a government, whether you're an NGO, whether you're a private entity like Merck, and try to develop sustainable answers. It's one thing to do philanthropy. It's another thing for all of us to come together and make the kinds of investments that we need to make in health and education so that we can truly say that we believe that all lives have value around the world.
I want to come back to this about how we do it, but as you know, we've been trying to work with you to address what you talked about, rebuilding the healthcare system. And our health access group and Partners in Health has been involved with a project funded by PEPFAR and Rwanda to retrain the whole healthcare workforce. Their goal is to not take any foreign assistance to run the healthcare system by 2020. I don't know if we're going to make it, but we're doing pretty well. And the most amazing thing is, as far as I know, it's the first major foreign assistance project ever funded by the American government that had only 7% overhead total, both at home and abroad combined, which should be a source of cheer to all of you who live in this space and are tired of us seeing 35% overhead. They really are doing a very good job. So what do you want to do? As you know, Jim Young Kim, the president of the World Bank, his major background is in public health, and he was one of the founders of Partners in Health. What do you want us to do now exactly to rebuild your health system?
I think the first thing we want to do, and that progress has started, is to train community workers as first responders. And that means equipping them with the education to be able to recognize a health problem, to have the means to report what they found to maybe the nearest health facility, and to make sure that they take responsibility for doing that. Training of healthcare workers at all levels. Doctors, as you know, we have shortage of doctors. Nurses, many of whom poorly trained, poorly paid. If we can get them the training that they need, and there may be some need for specialized training abroad, but training at home through the training institutions being strengthened and capacitated for be able to train a larger number of people. Bringing some of the experience of some of our African brothers and sisters, and I must say that I see President Kagame is here. We had people from Uganda, from Rwanda, from Ethiopia, from DR Congo that came, and because they had some practical knowledge and experience, not all in case of an experience with Ebola, but an experience with being able to give first care attention, first care service, and the fact that they can come and work with ours, and we'd like to encourage that. The private sector played a great role with the leadership of the African Union. They provided support for us, and we'd like to see us move into private sector healthcare delivery. It should not be just the government that does that, because we lack the quality of care. Those who have the money to be able to pay, for good healthcare service, go elsewhere, where they can get better quality service. So a private sector that can do this would help. And so training for our people is the key to it all. Thank you.
I agree with what you said about we have to develop sustainable business models to get these cures out. And one of the Millennium Development Goals we didn't meet was reducing maternal mortality by 75%. However, it was reduced by 45%, which is nothing to sneeze at. And you had the beginnings of water distribution of the HPV virus, which is very important in preventing cervical cancer. And there are some developing countries when it's been more widely embraced than in the United States, as you know. And we have this vaccine to prevent rotavirus, which causes diarrhea, which is the second largest cause of death of children under 5. So I know you can't really completely resolve this now, but tell us from, and you've been, I'm sure, an interested observer of the recent brouhaha about the fellow that exploded the cost of one critical drug and then somehow miraculously took it down. And in a way, it's been entertaining and educational, but it also turned a serious issue into a cartoon, and I don't think we can do that. What that is, what's the real answer to the cases where the research is not fully funded by the government? So you fund, or some other company funds a lot of research to develop and mass produce these vaccines. You have a duty to the people who finance your company to recover your investment plus a reasonable return, and you feel a duty as a citizen, as you proved last year, to get this out to as many people as possible who need it to stay alive, whether they can buy it or not. What system should we adopt going forward to avoid these fits and starts and these cartoonish expressions that can be dismissed quickly if you know that we're addressing the big problem? What's the answer to that?
Well, that's a very complicated question. Let me make a couple of comments. First of all, on average, it takes 15 to 20 years to develop a drug. And so it's important for us to have a sustainable approach to our business. We invest about $7 billion a year in research and development. We're trying to deal with about 90% of the world's disease burden, whether you're talking about cancer or Alzheimer's or vaccines. So it's important for us to be able to focus on issues in a sustainable way. I think what it comes down to is the right kind of partnerships, President Clinton. You talked about maternal health. We are in partnership with many people, including the UN, the Gates Foundation, and others. There's a lot that can be done here. There are 800 maternal deaths each day, and the sad thing is most of them are preventable, and they're easily preventable. If we can get women into the primary care system and get them a little bit of help, we can prevent most of those cases. And when a woman dies, her child is 10 times more likely to die, and her other children are 10 times more likely to live in poverty. So it's a critical issue, not only for that woman's life, but for her whole community's life. The solution to these problems, whether you're talking about HPV, where we had a great partnership in Rwanda with the Clinton Foundation, and we were able to get 100% of the girls in Rwanda vaccinated against cervical cancer. I wish we could say that here in New York. is the right kind of partnerships. And when I say partnerships, I don't mean partnerships just when an issue emerges like Ebola, because the whole world focused on Ebola for about 15 minutes. And when the current outbreak receded, it is as though the world forgot about it. Well, that virus is still out there waiting for another outbreak. And so what I would say, the answer to the question is, companies like mine need to invest in research, but we also need to take an attitude where we're trying to optimize sustainability and affordability. It's not our job to maximize the return on every investment we can have, because we are working in an area of public health where we have an obligation to our fellow man. At the same time, we also have an obligation to our shareholders to make sure that when they put huge amounts of capital at risk for a long period of time, they get a return on that investment. And so it's a balance that I think we need.
Let's go back to what President Sirleaf said about building the health system. I think it is imperative that the funding that was provided in, a few years ago when Hillary and Dr. Eric Goolsbee, who's now on our board, he was the head of PEPFAR, to Rwanda, this cannot be a one-off. That is, it's a wonderful story. But all over the world, a lot of aid agencies have already gone well beyond where the United States normally is with contractors, and everybody's trying to cut down on the overhead and increase the impact of their aid dollars. I remember the first time our climate change initiative at the Clinton Foundation started working with the Norwegians, they gave us zero overhead. I had to go raise the money from my friends to do it. And we were talking one day, and I said, I think we get a little bit now. But we had to prove ourselves. And I loved it. And I told him, I said, I would rather take nothing than 35% or 40% or some of the things I see. So, but the governments of the world and the international health organizations, it seems to me, if we want them to take the lead, along with the publicly funded research dollars that we and others have in developing the medicines, the governments and the international organizations have to take the lead in emphasizing system development more. I think you would agree. Nigeria lost exactly, I think, 19 people to Ebola. And one person who was affected went into the Lagos area, and they, knocked on 19 or 20,000 doors in a matter of days and shut it down. If President Sirleaf had had a system like that, thousands of lives would have been saved. So that's the point I'd like to make to all of you who have any influence over the development policies and the healthcare policies is the first obligation of the governments and the international agencies should be to work themselves out of a job by giving people the capacity to run their own healthcare systems.
Bill, let me say, Liberia, like many of our neighboring countries, are susceptible to other types of infectious diseases, malaria, typhoid, cholera. And so building a healthcare system that can really address infection is the key. But when you say that virus is still out there, I shudder. If I ever took that sentence back home, when are you going to get the vaccine for Ebola?
Well, we're working on it. We have a first stage successful outcome, but unfortunately, we can't declare it safe and effective until there's another outbreak. We need to see another outbreak and vaccinate people to ensure that we can prevent the transmission. Unfortunately, fortunately, it did subside, and we weren't able to do the full testing that we needed to do on this outbreak, but we're very encouraged on what we see so far.
That's good to hear, Bill, but like you said, while we're waiting for that, and I understand why he can't do it, we don't want to see another outbreak. If we can build the healthcare systems that can address infection and can improve our capacity to respond to any outbreak. We had a good experience in that regard anyway. If we can do that, then I think whatever happens, the vaccine would make a great difference, but also the capacity to be able to address that, the capacity to ensure that we continue our battle by bringing the incidences of malaria down and other types of infectious diseases. And the way to do it is to just get a partnership that enables to get those healthcare systems that would be able to respond and to be able to manage infection.
We're about out of time, but I want to make 2 points and then give you a chance to say one final thing. I know that this is not as sexy to some people as going in and fighting an epidemic, but one of the main things that animate a lot of us who work in these spaces is to have a day when we can go to a developing country and be nothing but a tourist and see our friends. And people want to be empowered. And so this system building thing, it may not be as sexy as riding to the rescue in the face of a disaster, but it keeps disasters from happening. And it makes the management of problems become part of the ordinary daily life of a country. I cannot tell you how important I think it is. Now, yeah, you can clap for that. Now, I want to ask you a question and give you a chance to have the last word here. We have in the United States a mixed system for developing medicines. For example, if the government pays directly through the NIH or through a university grant for the development of any advance, it can then be licensed to Merck or anyone else, and we let the universities keep the money as long as they reinvest it in further research. It's one of the greatest bipartisan efforts passed in December of 1980. After President Carter had lost the election, the Congress, by bipartisan overwhelming majority, said, let's do it this way. It was great. It passed unnoticed. It's profoundly important. It's allowed to multiple billions of dollars to be reinvested in totally non-political brown research. I think it is reasonable to conclude that the breathtaking evolution of what we know from the sequencing of the genome, this parallel research going on to the ability of whether we can treat the body's immune system into healing itself. All these things are going on. There's going to be a lot more opportunities to probably develop treatments to cure rare diseases that presently aren't treatable, to raise the cancer survival rate to some astronomical, unforeseeable level in the next few years. Do you agree with that?
I agree with that.
I mean, I think, it's reasonable to conclude that in the lifetime, at least of the young people in this room, every form of cancer survival rate may rise above 90% in theory. As these things happen, any difference that persists within countries and across national lines based on national income will become unbearable. So the question is, how are we going to, what's the answer here? Do we have to somehow, either on the front end or the back end, socialize the risks of developing these answers so that we can democratize the distribution of the solution? What do you think this whole research, recovery on investment, this whole business will look like? Or even better, what should it look like over the next 5 to 10 years?
Well, let me just start by saying that I think you hit the nail on the head. I think the cost of distributing these drugs and vaccines, especially vaccines, which we know are probably the greatest accomplishment over the last 2 centuries has been vaccination and preventing disease. The cost of distributing it in an equitable way, I think, is a societal burden that we should all share in. I think the upfront part of it, I believe that as unpopular as it is, the best system that has ever been devised for developing new drugs is the private capital system. Companies like mine take huge amounts of risk, and there's a huge amount of focus on let's make sure that we are putting our scarce research dollars into those programs that have the greatest opportunity to meet unmet need and also have the greatest technical probability of success. I think that part of it has worked well to produce new drugs. I think the challenge we have is health is not like a commodity. It is something that as a society we want to make sure is available, and people's ability to pay should not be the barrier to them having medicines and vaccines that they need. So the question becomes, how do we develop a system that provides the incentives, the market incentives to develop new drugs, but at the same time plays the right role of society in making sure that it does get to everybody? And I think that's a big challenge, but I think it's one, actually, use your beginning. The trend lines are better than they used to be. We are, in this country, I think it's a great thing that we've decided to provide health care to all of our citizens, finally, after all these years. And while that places pressures on our business model, I think those are pressures well worth taking, because in the long run, what's good for patients is what's good for us.
I agree with that. I think what we're going to wind up seeing is radical transparency in what the source of funding was to develop these drugs, and then appropriate, let's say you develop a cure for Ebola, okay? Then we know 100% of the people need it or will have massive mortality. Let's say, I'm making all this up, but let's say you got a contribution from research funded at some university, MIT, you name it, Harvard Medical School. I think there will be a formula developed, and then we will socialize on the front end the cost of reimbursing this, rather than running it through an insurance system, which will drive up everybody's insurance rates and be an inefficient way of doing it. That's all I'm saying. You've got a right to recover what you invest. Because, and I agree, we want to keep you doing it. The government can't do all this stuff. But we'll, for all of you who think about this in the wealthier countries and how to first get it out to your people and then how to get it out across the world, you got to figure out, have a system that finds the answers quickest, then figure out what you've got to do to democratize the distribution without bankrupting the insurance system or bankrupting the budgets. Let's give them a hand. It was great. Thank you.